Dr. Montgomery Rice, what do you think is causing the lag in the vaccination rollout?
Well, I think, first of all, if you look at what was at the beginning, was they thought that, okay, because it's 2 doses, the two that have been approved, Moderna and Pfizer, that the federal government, as I understood it, they were withholding some part of it so that people could be eligible for, we would have doses for people to have their second dose, right? So they would send it out to the state based on the prioritization that we have put forth on who should get vaccinated first, second, third, fourth, and we're giving them the dosage that they needed for that population in a staged manner, and then holding back 50%. Well, there was a study that just came out of the Annals of Internal Medicine that said that by reducing the amount of vaccine doses withheld to only 10% instead of 50%, we would be able to supply a steady dose of 6 million doses per week, which in the US could avoid 29% more cases over 8 weeks. This is a moving target, and so we have to be agile. We have to be flexible, remembering that they are recommendations that have been put forth by the FDA and the CDC and the National Academy of Medicine about how we should stage who gets vaccinated. Does us no good to have a bunch of vaccines. They only become relevant when they are in people's arm and they become vaccinations. And we have heard of cases where people have been discarding vaccine because they got to the number of people that they could vaccinate based on the categories, and there was still amount of vaccines left in vials that could equate to a dose. Well, we don't want that to happen. So what we need to do is be agile and common sense. Agility along with common sense. So eventually we want everybody to be vaccinated. So if I'm in a room and I'm giving out vaccinations and there are people, let's say like our mayor here, who doesn't quite meet the age range, but he is an essential worker. And if I had vaccine available, I would ask him to step up right then and take that vaccine. And
Keep on
so
talking.
if you know,
Keep on talking.
if you
Advocate.
know, yeah, if you know, it came out earlier today. The Biden-Harris administration has acknowledged that they're going to ask for release of all available vaccine doses and break away from the current administration policy. And so I think that we are going to have more access. Now, this is really important, Jonathan, because we're doing a vaccination Saturday here at Morehouse School of Medicine. And because on Tuesday, we vaccinated civil rights leaders, 30 of them, Ambassador Young, Dr. Lewis Sullivan, Henry Hank Thomas, Freedom Rider, Henry Hank Aaron, and 26 others. And we then announced that we were going to do these vaccination Saturdays for the next 4 weeks. We have gotten 2,000 calls. And we were talking about people 75 and older. So please don't tell me that Black people don't want to get vaccinated. That's not true. They are ready. But here's the challenge: manpower. It is a process. You have to get the vaccines in a thawed position. You then have to unthaw them. You have to let them sit at room temperature. You have to have appropriate people who can draw them up and then actually administer the dose. You then have to monitor people for at least 15 minutes. And at that time, we're using our medical students to hopefully get them to fill out the V-Safe app so that they can report their symptoms afterwards. So it is about a 40-minute process if you do it right with registration, vaccine, because actually get the injection takes 5 minutes. It is the watching afterwards and the little bit of work before so that we can make sure that we can document everybody who's been vaccinated, give them the right information such that they come back in 3 weeks. So manpower, we need more resources at the state level, at the city level, and in our departments of public health so that we can hire additional personnel to help with the administration of the vaccine.